Howdy y'all, welcome to today's Poop Tip Tuesday. We have a great show today. In today's video, we're going to discuss a hiatal hernia and how you can treat this naturally. We'll talk about adhesions. Now, this may be the reason why you're having gut issues. And we'll talk about my recommendations on how I recommend to get your gas and bloating taken care of. Guys, if you're wondering about all these questions, this video is for you. Let's talk about poop. Howdy y'all, Dr. Islam here, aka your poop guru and gut microbiome expert. My passion is to give you, yes you, the best tips and tricks so you can live your best life. If you haven't already, don't forget to smash that like button, like, share, and subscribe, and come see me, your poop guru, to get all your GI needs taken care of. Every Tuesday, I go through my social media streams to answer your DMs and questions you guys have for me. If you have a question you want to send me, here's what you need to do. Subscribe to my channel, subscribe to my newsletter, send me a DM or a message, and I'll send out a survey every couple of weeks on my email newsletter. That is the best way to get all the best information going straight to your inbox. All right, we have a great show today. Our first question, hey Dr. Islam, I have a hiatal hernia. What is it and what can I do naturally to get this taken care of? So a hiatal hernia is very common to have. This is where part of the stomach goes above where it should be to cause symptoms of acid reflux, heartburn, trouble swallowing, and some pain. You have what's called a diaphragm, which separates the esophagus from the stomach. It keeps the stomach below the diaphragm and keeps the esophagus above the diaphragm. Sometimes you can have a defect in that diaphragm or part of the stomach goes above it to trap acid to cause what's called a hiatal hernia. Now, for hernias, especially a hiatal hernia, you cannot see that typically on your body. An umbilical hernia, absolutely you can see that, but a hiatal hernia, typically you cannot see that. Now the way we know you have one is for us to actually take a look with a scope or maybe doing some imaging as well. We can see where part of the stomach is above where it should be. So what exactly do we do for a hiatal hernia? The thing I tell all my patients is that just because you have a hernia does not mean it needs to be taken care of. So if you're not having symptoms, don't worry about it. Here are the symptoms that typically can be due to a hiatal hernia. Really bad acid reflux, especially acid reflux that's not controlled with diet or medical therapy. Trouble swallowing. Food can get stuck in that hernia to cause you to have issues and that may need to be repaired. Severe pain in this area where the hernia is, that can also be a reason to get your hernia taken care of. Now there are a couple of natural things that we recommend to hopefully get your hernia symptoms controlled and get you feeling better. Number one, have small frequent meals throughout the day. Having big meals can sometimes get stuck in that hernia sac and cause acid to occur, cause regurgitation, cause you to have trouble swallowing, and so having small frequent meals all throughout the day can pass through that hernia and get into your stomach. Number two, wearing tight clothing can actually push on your belly and cause that hernia to act up. So I know it sounds weird, but have loose clothing. Don't wear something that's tight and it's constricting, no, because that's also going to constrict your hernia to make these symptoms worse. Number three, practice good eating habits. What does that mean? Well, chew your food slowly. Don't overeat. Don't lie down as soon as you eat. These are things that are actually important to keep your hernia in check so you don't have symptoms from that. And then lastly, lose weight. The more weight you have on your belly, the more likely it's going to be for the hernia to act up and cause issues. So lose weight or at least maintain a healthy weight. But let's assume you've done all this and it doesn't work. What are other options to get your hernia taken care of? Well, you can certainly consider surgical therapy. Surgical therapy is an option to get your hernia fixed. It may resolve your symptoms and get you feeling better as well. And if you want to get that done, come see someone like me in which we can evaluate exactly what's going on to get your hernia taken care of. So here's my question for you. Let me know if you have any questions down below about a hiatal hernia, what it is, what it entails, or if there's something else I did not answer, comment down below. I would love to hear what you guys have to say about this. Question number two, hey Dr. Islam, I have a lot of bloating and constipation. Do I have adhesions? I love this question because it's a very common question I get from my patients. So what exactly are adhesions? Adhesions are scar tissue in your body or in your gut that can be typically due to prior surgery you've had for another reason. So for example, let's say you've had a hysterectomy. You could have adhesions or scar tissue in your gut that can tie off your stomach, tie off your colon to cause symptoms to occur. Let's say you've had your gallbladder removed. Those adhesions from your gallbladder can cause pain and bloating to occur as well. So adhesions are like scar tissue that can really run rampant inside your GI tract. It prevents your stomach from moving, it prevents your colon from moving. It can twist on itself and cause pain, distension, bloating, and constipation. So how do we know this? I will tell you, it is hard for us to know if adhesions are the cause for your symptoms. It really is. We have to have the right history, so history of surgeries in your body. You have to have the right symptoms, and sometimes we can see this on imaging, but more often than not, we have to have you see a surgeon. They may have to take a look and see with the scope to see if there is any adhesions there that need to be lysed off. Now, there are things that you can do to maybe minimize some of those symptoms. Sometimes having small, frequent meals throughout the day can lessen the burden on your GI tract. Avoiding foods that can cause bloating, constipation. So these are called high FODMAP foods. FODMAPs are foods that are known to cause a lot of bloating and gas, and sometimes minimizing that can help out with your GI issues and the adhesion symptoms as well. Making sure you're not constipated or keeping things inside your GI tract can make things worse. So taking a laxative, adding some fiber or some magnesium can certainly help out as well. But if all this doesn't work, it may be best to come see someone like me, your poop guru, or even seeing a surgeon to find out exactly what's going on. So let me know in the comments down below if you have a question about adhesions. How do we address this? What can we do? So I can hopefully answer these in future videos. All right, question number 3. Hey, Dr. Islam, I have a lot of bloating and distension. What are my tips that I recommend to get you taken care of? Bloating is such a common problem. I see this all the time, and it's hard to know specifically what can be causes for everyone. But here are my tips. So number 1, if you have constipation that needs to be resolved. Constipation and bloating can be one and the same. Keep in mind your GI tract is one long tube. If one part is clogged up, it can backflow with gas and distension and make things worse. So if we can get you going and flowing, that can help out with your bloating. Number 2, anybody who has bloating, I recommend for them to eliminate all dairy products. That includes all the good stuff, cheese, milk, ice cream. Yes, you need to minimize that because you may not realize that you are lactose intolerant. And by eliminating those foods, we can hopefully resolve those issues. Number 3, avoid artificial sweeteners. A lot of us don't realize that the ingredients in artificial sweeteners can make it more difficult for us to digest, leading to bloating and distension as well. So eliminate those artificial sweeteners. If you're chewing on sugarless gum or hard candy, you need to minimize that as well because they also have ingredients in there that are hard to digest and can make bloating worse. And then lastly, symptomatic care. Try things like Beano or Gas-X. These things actually work to break up the bubbles to hopefully find out and eliminate those issues to get you feeling better as well. These are my tips that I recommend when it comes to bloating. Let me know in the comments down below, what have you tried, what's worked, what hasn't worked, so I can use this to hopefully help out with my patients who have bloating issues in the future. Guys, well, thank you for watching. Every Tuesday, I put up my Poop Tip Tuesday where I answer your questions you guys have. If you want me to answer your question, here's what you need to do. Subscribe to my channel, subscribe to my newsletter, send me a DM, and wait for me to ask a question on my survey so we can hopefully answer your questions you guys have on future videos. And thank you for watching. Don't forget to smash that like button, like, share, and subscribe. And don't forget to come see me, your poop guru, to get all your GI needs taken care of. And thank you for watching. Don't forget, let's talk about poop. Thanks, everyone.